For the last 20 years, I've had something going on, and my weekends were pretty much recuperating from my work week. I'd been having more dizziness. I'd been having more stability problems.
Before surgery, I would have gone to brace her because if she would make a quick turn, she would get dizzy and nearly topple over.
It was getting tough to get going. Activities like my niece's one-year birthday party was not even something I could even think about doing. Something needed to be done.
Her final diagnosis was what we call a cystic pineocytoma. She originally was told she had a pineal cyst, but sometimes you can have tumors called pineocytomas that can look cystic. And so in her case, that's what she ended up having.
Because it's so rare, there's not a lot of doctors that treat it. There's actually many doctors that refuse to treat it and won't.
The thought is that pineal cysts are supposed to be benign and they don't cause symptoms. I happened to remove these from a few patients who had large ones, and their symptoms improved, to my surprise. What was once thought to be asymptomatic pineal cyst is probably not so. That a lot of these patients who come in with symptoms like she had, headaches, dizziness, nausea, double vision, may be actually related to the pineal cyst, and it turns out that it's not just a benign cyst, it's a benign tumor.
And we came out to see Dr. Patel, and then once we met him, we were just very, very happy and felt very comfortable with him.
Dr. Patel just had a way about him. So when we met with him for the first time, it was a click. It was meant to be.
The surgery involves doing a craniotomy, opening the skull in the back of the head under general anesthesia. It takes me about an hour to hour and a half to do the surgery. So she doesn't have to worry about long-term effects. She doesn't have to worry about malignancy. So once you remove it, they're cured. So her prognosis is excellent now.
And when they did an eye test on her, she could look up and she could look side to side, and that used to make her very dizzy and uncomfortable, and it caused a little bit of pain. She did that like a piece of cake, and she looked at me and was like, that didn't bother me that time. It was about 5 or 6 symptoms that have gone away already, and the other ones are looking pretty good. So I don't know, I'm very optimistic.
I'm actually just kind of hoping to get my life back and be able to enjoy, like I said, my niece's birthday party and maybe go out to a movie and enjoy the things that I was struggling to do before.
At MUSC, both not just with the hospital stay, but with our pre-op appointment and consultations, the staff was super, super friendly. I think it made Kristin more comfortable because people were so nice. You just feel more at ease. And when you're going in for something like brain surgery, I think little things like that help you feel more comfortable.
Between Dr. Patel and the staff here, it made the process a lot easier. And this has gotten me through to this point where I can honestly see a light at the end of the tunnel. And it's much happier than I was 5 months ago.